Healthcare professionals are expecting a surge of COVID-19 cases to happen by the end of April. If that happens, as ABC4's Jason Wynn shows us, doctors may have to make some very difficult decisions.
Utahns really have two choices to make. Stay at home to protect their loved ones or risk putting them in a predicament where doctors may have to choose who survives when the surge of COVID-19 happens. Nearly 2 years ago, the Utah Hospital Association and the Utah Department of Health developed the Crisis Standards of Care Guidelines.
As events play out, if we do need to start making triage decision, it would be under an order of the governor or some health authority.
Greg Bell is the president of the Utah Hospital Association. He hopes it won't have to get to that point, but if it does, administrators will need to implement a crisis triage officer team at their hospital and use the patient prioritization tool that looks something like this, with caution.
If a patient is very susceptible because of multiple underlying conditions and age, because of immunocompromise or something, then clearly they're going to be prioritized at a lower level than someone young and strong who's expected to recover.
A lot of that will come down to resources like personal protection equipment and ventilators. In the last report, the state indicates it has around 600 ventilators. It's a stark contrast to the 6,400 ventilators officials called for then to deal with the pandemic, or how many we have right now. Regardless, health officials believe the surge of COVID-19 will happen by the end of April.
Currently, all of our healthcare systems are able to handle the patients that come into their hospital right now, so we haven't had the need to activate those teams.
All the medical professionals I talk to say staying at home and social distancing is working, but if you do need medical care, you'll get the best available. I'm Jason Wynn in Murray, ABC4 News.